About a year and a half ago, there was a tremendous buzz about the topic of xenotransplantation. For those viewers not familiar with this concept, here is a brief illustration of the basic idea.
I put animal parts in you.
Okay, maybe a more detailed explanation would be helpful. Xenotransplantation is the act of taking an organ from an animal and transplanting it into a human. It is contrasted with allotransplantation, which is the transfer of an organ from one person to another. Once the animal organ has been transplanted, it is known as a xenograft. In all seriousness, this has the potential to save a lot of people. There are currently about 100,000 patients on the waitlist for organs in the United States. 17 people die in this country every single day, waiting for organs that never come. Several options for addressing this problem are being explored at once. You've probably heard of the idea of 3D printing organs with stem cells, which will probably get its own video at some point. Another option is finding ways to get the body to grow new organs. Xenotransplantation is yet another idea. The appeal isn't hard to understand. We already farm animals for food, and many species reproduce much more rapidly than humans. If this can be made to work, it could potentially mean that we would have an endless supply of organs, on demand. This is something that has been on the drawing board for a very long time, as we will see. What has changed recently is that the technology has finally matured enough that we are now on the cusp of it actually being a real option for those in need of organs, and this has set off a bit of a scramble to bring us the rest of the way. That is what led to the rash of xenotransplantation experiments that we saw in 2021 and 2022, as well as future experiments that are planned. By the way, if you've noticed that my voice sounds slightly off, that's because what you are listening to is a text-to-speech AI program. I have cerebral palsy, which causes me to have a severe speech impediment. If I narrated this video with my real voice, you wouldn't be able to understand it. Luckily, that isn't an obstacle to me starting a YouTube channel, thanks to Murph. With Murph, I can just type what I want to say and have it converted into a perfectly clear synthetic voiceover, within seconds. If you think you might want to use Murph for your own video projects, follow the link in the description. In this video, we're going to take a look at xenotransplantation. Its past, its present, and its future. Hopefully, someday soon, this technology will make organ waitlists obsolete. Part 1. A brief history of xenotransplantation. Although the concept of xenotransplantation may seem new and shocking, it actually goes back several centuries. Various attempts were made between the 17th and 19th centuries, to no avail. The idea all but died in the 1920s, when the phenomenon of immune system rejection came to be understood. Then, in the 1960s, the first immunosuppressive drugs were developed, leading to a revival of interest. In addition to the use of such drugs, this time was also characterized by the use of non-human primates, particularly chimpanzees, as organ donors, as it was thought that they would offer the next best thing to allotransplantation. The first serious experiment, in this vein, took place in 1964, at Tulane University in New Orleans, Louisiana. 13 patients, who faced death from renal failure, received double kidney transplants from chimpanzees. Nearly all died within a month or two. The one notable exception was a woman who survived for 9 months, even returning to work before suddenly collapsing. Interestingly, the autopsy showed no sign of rejection. Instead, her death was due to acute electrolyte imbalance caused by excessive urination. The Tulane experiments inspired several other attempts using organs taken from chimps and baboons. Unfortunately, none of those were successful either. By the 1990s, a consensus had been reached that pigs would make ideal organ donors, despite being more distantly related to humans. This was for both ethical and pragmatic reasons. On the ethical side, primates are highly intelligent animals, with rich emotional lives, and many of them are endangered. On the pragmatic side, since they are slow to mature, it is unlikely that we would ever be able to produce usable organs from them at scale. Pigs, in contrast, mature much faster and have large litters. Also, their organs are much closer to the human size range than that of the smaller primates, like baboons. Of course, this meant that immunosuppressive drugs would never be enough by themselves to prevent rejection. Luckily, around the same time, the first primitive gene editing tools became available. This led transplantation experts to make the natural leap. What if the pigs could be genetically modified so that their organs would not evoke the typical immunological response when transferred to a new human host? The idea was simple, at least in principle. Cells would be taken from pig fibroblasts, the connective tissue between organs, and edited. Their nuclei would then be transferred into egg cells before being implanted in a surrogate mother. This is the same technique which was used to clone Dolly, the sheep, back in the 1990s. The piglets would then be reared in a hermetically sealed facility to ensure that they were free of any germs which could be transferred to a human recipient. The pigs would be kept in the facility until such time that an organ was needed. By the early 2010s, CRISPR had been discovered. Being much more precise than previous methods, it made this idea truly viable for the first time. Over the next decade, CRISPR technology would mature, and various nuances to the approach would be hashed out, eventually leading to the xenotransplantation renaissance that we are seeing now. Part 2. Preliminary experiments in xenotransplantation. Beginning in September 2021, a series of experiments was carried out by Dr. Robert Montgomery, surgeon and director of the Transplant Institute at NYU Langone, and colleagues, to test the viability of transplanting genetically engineered pig organs into recently brain-dead humans. These were people who were considered legally dead and who had donated their bodies to science. Since the advent of CRISPR, we've learned a lot more about the mechanisms behind the immunological rejection of transplant organs. To make their experiment work, there were essentially two hurdles that Montgomery's team needed to overcome with gene editing. First, pig cells are coated with sugars and proteins, collectively known as antigens, which the human immune system uses to recognize them as foreign. Second, pig cells contain endogenous retroviruses, which are the remnants of ancient viruses that have been disabled and permanently incorporated into the pig's genome. When the organ is transferred to a human, these dormant pathogens can reawaken and infect the new host. I made a video about the CRISPR-Cas9 system and its more advanced offshoots, which you can check out here. In that video, I described how the original system can be used to remove or knock out unwanted genes. This technique can be used to snip out both endogenous retroviruses and the genes which code for antigens. A second technique which allows one to insert or knock in new genes, also covered in the video, can also be used to add human genes in order to fool the immune system into accepting the pig organ as self. In the first round of experiments, Montgomery and his team transplanted 2 kidneys that had one of the major pig antigen genes deleted. The organs were supplied by the biotech company Revivicor. The study lasted 32 hours, during which time the organs showed no sign of rejection. The kidneys successfully produced urine while filtering the dangerous chemical creatinine from the bloodstream. They did, however, produce urine at about twice the rate as human kidneys, echoing the results of the Tulane University experiments. At about the same time, another team at the University of Birmingham, led by Jayme Locke, a former student of Montgomery's, performed their own pig-to-human kidney transplants. This team opted for organs from the 10-gene pig, also from Revivicor, so called because it has had 10 edits. 3 knocked-out genes and 6 knocked-in human genes, plus an additional edit that prevents the organ from growing too big once it is transplanted. The results were similarly encouraging. The Montgomery team would later do 2 cardiac transplants with 10-gene pigs. This second study took place over 66 hours, during which time there was no sign of rejection. Although one of the hearts declined in function over the course of the study, this was later attributed to it not being the right size for the body. Here's a short clip of Dr. Montgomery talking about the experience.
When we transplanted the kidneys, within moments of the blood from the human, rushing into the organ, the kidney started to make urine, and urine was squirting out, the ureter. That's very dramatic. But even more dramatic was to see, a pig heart pounding away in the chest of a human being. I just never thought I would see that in my lifetime. It was just a awe-inspiring moment.
Part 3. The case of David Bennett. About 3 months after Dr. Montgomery and his colleagues began their experiments, the first ever live human patient received a heart from a genetically modified pig. Covered with much fanfare by news and media outlets all around the world, the case of David Bennett has generated both hope and controversy. David Bennett Sr., a 57-year-old Maryland resident, was knocking on death's door due to heart disease. After being declared ineligible for both a standard heart transplant and an artificial heart pump, he was approached by Dr. Bartley P. Griffith, medical director of the cardiac xenotransplantation program at University of Maryland Medical. Bennett agreed to the experimental procedure, seeing it as his last chance at life. The U.S. Food and Drug Administration gave emergency permission, under compassionate use, on New Year's Eve of 2021. In addition to a heart from a Revivicor 10-gene pig, Mr. Bennett also received an experimental immunosuppressive drug. Just a couple of days after surgery, Mr. Bennett was taken off the machines, which had been artificially keeping him alive. He was soon sitting up in bed and able to participate in physical therapy. Here is a clip of Dr. Griffith and David Bennett's son talking about the groundbreaking procedure.
That new heart's still a rock star. I would say it has more than exceeded our expectations. He gave me a big thank you today, of all things. It just set me back on my heels. I should be thanking him for all he has done.
My dad's a fighter. He was chosen to do this. He chose to do this. He wanted me to know that regardless of what happened, he wanted to help people. He realized even more days leading up to the surgery that this provided opportunity and hope for others.
Unfortunately, Mr. Bennett passed away about 2 months after receiving his xenograft. However, the cause of death doesn't seem to have been rejection. Rather, it was a virus. Not an endogenous retrovirus, but a common germ that ordinarily infects pigs and had managed to hitch a ride. Although the virus was incapable of infecting human cells, without the presence of the pig's immune system, which had evolved to keep it in check, it was free to proliferate and attack the heart itself. This caused the cardiac tissue to thicken and grow stiff, ultimately losing its ability to pump blood. The fact that the virus was present at all was surprising, given that the pig had been raised in a biosecure facility and screened several times for such pathogens. In fact, it had been screened for this virus specifically. This points to a need to develop more sensitive tests and more rigorous isolation protocols going forward. Alongside Dr. Griffith, the study was also led by Dr. Mohammed Mahiuddin, the scientific program director of the cardiac xenotransplantation program and one of the world's leading experts on xenotransplantation. He had this to say regarding the incident. "We consider this to be an important learning experience. Knowing what we know now, we will alter some of our practices and techniques in the future." Part 4. What's next for xenotransplantation? Despite the disappointment of Mr. Bennett's death, the results of that experiment, as well as that of Montgomery's team, were promising enough for the field to move forward. In fact, it seems to be about to take off. Here are just a few examples of what is turning out to be an international effort to bring xenotransplantation to the masses. Revive Vucor, in spite of the setback, plans to spend $100 million on a new biosecure facility. The 50,000 square foot building, which will hopefully open in 2024, will supply organs to 3 hospitals: Johns Hopkins University Baltimore, University of Maryland Baltimore, and New York University, for further experimental trials. If those succeed, then even bigger facilities will be built to bring the technology to market. One of those hospitals, Johns Hopkins University, just received $21.4 million from United Therapeutics, Revive Vucor's parent company, to conduct a 2-year study for the purpose of advancing knowledge in the field. The university has a thriving xenotransplantation research program led by Drs. Andrew Cameron and Kazuhiko Yamada. Regarding the aims of the study, this is what Dr. Yamada had to say. Our research team hopes to improve the strategies and techniques that have made genetically modified pig kidneys for transplantation so promising to this point, and then take them to the level where human clinical trials can begin. Then, hopefully, we can finally realize that promise. Meanwhile, eGenesis, a rival to Revive Vucor and United Therapeutics, has iterated upon the 10-gene pig strategy, producing animals that are even more genetically modified. These new pigs have anywhere from 50 to 70 knockout genes, plus 7 human knock-in genes. The company has good reason to go above and beyond in ensuring that its product is safe. It plans on performing cardiac xenotransplants on infants with congenital heart defects. Such cases represent a crucial unmet need, as half of all infants with such defects die, and there are even fewer donor organs available for allotransplantation than there are for adults. The hope is that, at the very least, the xenografts will buy the baby's time until suitable human organs can be found. Finally, across the pond, in Ireland, Dr. Philip Cardiff, researcher at University College, Dublin, has just been awarded a grant from the European Research Council to pursue an unique project. The grant, worth €2 million, or around $2.2 million, is given out to exceptional scientists to enable them to pursue their most promising ideas. In Dr. Cardiff's case, he wants to address an important unknown when it comes to pig-to-human cardiac transplantation: its effect on circulation. Dr. Cardiff is approaching this from an engineering perspective. Although pig hearts are broadly similar to human ones, there are differences in size, shape, and mechanical properties. This can cause changes to the patient's blood flow that are poorly understood and difficult to study experimentally. To address this issue, Dr. Cardiff and his team plan to develop advanced, highly detailed computer models to predict these effects. The project, called XenoSim, is expected to provide fundamental insights that will guide cardiac xenotransplantation efforts going forward. Conclusion. Norman Shumway, the father of heart transplantation, is quoted as saying, "Xenotransplantation is the future and always will be." This is reminiscent of what is often said of fusion energy. Of course, we all know that, in December of last year, the Lawrence Livermore National Laboratory achieved ignition. That is, they set off a fusion reaction that produced more energy than had went into it. What's more, they repeated that experiment just a few days ago, at the time of writing, with an even bigger energy yield. It seems that xenotransplantation is having a similar moment, and at about the same time. After literally centuries of failure, the dream of a future where anyone who needs an organ can get one, in short order and at relatively low cost, seems about to be realized. This is a really good demonstration of why I never take seriously the "we've been trying for a long time to make this work, and it has never worked, so it will never work" argument against any theoretical technology. As long as the thing is possible, in principle, and the potential reward is great enough, we will eventually find a way to make it happen, even if it takes 300 years. I don't know if we'll ever get a working warp drive, but just about everything else seems to be on the table. So it is with xenotransplantation and fusion energy, and so it is with ending disability and disease. In my own case, I am very optimistic about the prospect of cerebral palsy being cured within my lifetime. I mean, honestly, which one sounds easier, replacing a few dead brain cells or making a pig heart work inside of a human being? The same can be said of any other condition or ailment that might befall a person. There is no disability or disease that cannot be cured. Because I cannot help myself, and at the risk of sounding arrogant, I have a suggestion for anyone in the xenotransplantation field. One of the difficulties in producing heavily gene-edited pigs is that the knock-in method isn't as reliable, which could lead to inconsistent results. Well, in my video about the various CRISPR tools, I covered PASTE. This is a new method of adding genes that was developed by Omar Abu-Daya and Jonathan Gutenberg of the McGovern Institute for Brain Research at MIT. It is apparently highly efficient and can insert up to 36,000 base pairs into the genome of cells. Maybe it could be used to insert even more human genetic material into pig cells with more reliability. Just a thought. Thanks for watching the video. If you got something out of it, then please consider giving it a like and subscribing to the channel. You can also follow me on any of these social media platforms. And, if you really like what I'm doing, you can support me on Patreon. The links are all in the description.